Hello and happy Friday. Now today I thought we would take just a little medical tourism trip through Europe and beyond to talk about different products that might make their way here to the United States, and specifically some of the injectable products. Now, the idea of an injectable actually kind of starting in other parts and coming to the United States is not new. The Restylane line, for example, started in Sweden, and the RHA line started in Switzerland. So once established in other parts, those were then brought to the United States, to the US market. But it turns out there's some other new entries that might make their way here. So one of the first ones of interest is called Profilo, which is it's a UK product. It's in Europe, it's in England right now. And as a boosting agent, it again works very similar to one of our products that we have out there called Skin Vive, which is from Allergan. It is actually more of an intradermal or just immediately subdermal as an injection, and it's really not a volumizing agent. It's not like a wrinkle treatment as such. It's really something to help the skin look hydrated, and it essentially tries to draw moisture to those skin areas from within. A second one then is called Meso-I C71, which is also in the UK. And that has now taken the hyaluronic acid, or the HA product, as part of it, and then it couples that with a peptide. And that peptide then is supposed to stimulate the microcirculation and the lymphatic tissue to, again, essentially drive more kind of rebuilding into the skin. And it's used for a number of different areas, including around the eyes, to help for, let's say, saggy eyes or baggy eyes or dark circles around the eyes as well. There's a third one out there that's called Belotero Revive. That's also in the UK. That one also is, now the Belotero line is not new. There are products in the United States from the Belotero line, but at this one, what they've done is they've taken the HA product and they've bound it or included glycerol in it. So that the idea is glycerol is another hydrating agent, and in the end product, the description is to provide a nice glassy surface quality to the skin, something really smooth. One fourth product is called a polynucleotide injectable. That's actually more in Australia right now. And it turns out it's from a source I won't get into, but it's essentially a fish DNA source. And what that then does is it's more of a biostimulatory product. It's essentially trying to get into the skin and then rebuild collagen formation, rebuild elastin formation, and essentially, again, make your own skin do this work as opposed to, let's say, a hyaluronic acid product, which is a filler. The final product type is those that are seen, for example, right now in Asia and Brazil, and they're combination treatments of HA filler coupled with the neuromodulators like Botox or Dysport. But as a combination treatment, those then can get the best of both worlds with one injection or one series of injections. Now, the question always is begged then, well, why is it this is happening in Europe and not necessarily here in the US? And it really goes back in part to the FDA approval process. Here in the US, it's a very stringent process. The FDA demands a number of studies, typically, and a large population of patients in those studies. So the actual quality or the stringency of the testing is very high, and therefore it's very expensive. So sometimes these products might have a great run in Europe, but they can't quite make it to the United States. So in this case, for example, with these examples here, we have no idea if they're really going to finally make it here. But the idea is it's exciting, and if you happen to find yourself in Europe, Asia, or even Australia, you may want to check it out. I think they're interesting products, and we'll see if they finally make their way here.